Good afternoon, everyone. Wayne Brown here with Haywood Healthcare's COVID-19 update for Friday, the 19th of November. We've got a special guest with me today, Joe Doyle, who is our Director of Infection Prevention. I'm going to give you just a brief update, and then Joe's going to give us an update on what's going on in our region, okay? So just from a testing perspective, we have tested now almost 118,000 specimens, which is huge for our organization. Our community positive testing rate is up actually throughout the pandemic up to 5.4% versus the state at 2.72, and our 7-day positive average rate is 14.42%. The state is 2.84, so it tells you why I've invited Joan here today. So we're surging. We're number 6 in the state overall, and Gardner, Winchendon, and Athol are the 3 highest in Worcester County as well for prevalence of COVID-19. So we're going to talk a little bit more. There's some information that's in this email as well that you can take a look at and refer back to. But Joe's going to talk about the bump up in the graph right here that you will all be able to see. Just a reminder, you get boosters for COVID-19 at CVS and Walgreens. A couple new things one new thing at Haywood is we now have tele-NICU services available. And there's a picture with Dr. Yulia Osteroff, one of our pediatricians in the LaChance Maternity Center, demonstrating that equipment, so you can take a look at that. And then yesterday, Jim Meehan, longtime trustee of Athol Hospital and one of the key drivers behind the marriage of Athol and Haywood Hospital, stepped off the board and retired yesterday. So we had a very nice send-off for him and want to thank him for all his years of service and leadership. Reminder employees that our employee engagement survey went live, so please hop on and take care of that. And let us hear what we need to do to be an even better place to work. There's some information on caring for our colleagues, and then reminder that open enrollment is open for benefits for 2022. In prior years, you could just be passive and let it roll over. This year, every employee has to re-register online and make all their new commitments because we're on a new platform. So please do that. And then lastly, we are collecting crutches and walkers from the community, the aluminum type. We all seem to have something at home. There's a shortage of those, and we need those for our patients, especially those who discharge from our emergency room. So, Joan, we're seeing a big spike and a surge. Tell us what's going on and what we need to do.
So, yes, we are seeing a very big surge in our area. We've been surging since the beginning of July, just after the 4th of July holiday. It's been steadily increasing, although this past week we saw a huge surge. Jumping up, especially in Gardner, 26.9 points. Winchendon jumped up about 25 points, and Athol jumped up about 14 points.
But everybody talks about the pandemic in the past tense.
It is not in the past tense, and actually for us, these are the highest numbers that we've ever seen during the whole course of this pandemic so far. The good news is that there are less hospitalizations, there are less people dying, but the infective rate and the positivity rate is so much more high than it ever was before.
And on the inpatient side, what percentage of patients are we seeing that are vaccinated against COVID-19?
So over the course of the pandemic, since vaccination became more popular, it's about a 80-20 split. It waxes and wanes from here to there. Right now, presently, we're at about 80% split between vaccinated and unvaccinated.
But is it safe to assume in general that the majority of the patients who are vaccinated with a breakthrough case are not in our ICUs?
That's correct. That's correct, yes.
So we're seeing
much higher rates of positivity, but lower rates of hospitalization, although the hospitalization rates are increasing. Mm-hmm. We are seeing, as we've discussed before, the emergency departments are getting a little overcrowded because there are no inpatient beds, and the inpatient bed volume is largely driven by the COVID patients who are in the hospital who have extremely long lengths of stay. Yeah. So their admissions are quite long. Usually an admission is 2 to 4 days, and we have patients that stay up to 40 days now.
Yeah, so a lot of pressure on the hospital and the practices and our urgent care. So what can we do to make a dent in this? We talk about the need to get vaccinated. But can we talk, I think there's a changing demographic, age-wise as well, in who is getting infected?
Sure. Over the last 3 weeks, we've seen a large increase in the number of minors. So these are the people who are not able to be vaccinated yet, although 5 to 11 is now approved for vaccination. So we would encourage you to get your children vaccinated at this point. A lot of positivity coming through the schools. I believe that there are some closures of schools. Some schools in the state have gone to full remote learning again. We're looking at canceling community events and things like that are starting to happen again because of the rates in the schools are increasing.
I think we heard that the Winchendon Narragansett annual Thanksgiving football game has been canceled because of COVID-19 as
Yeah.
well. So that's just an example of
Yeah.
the lack of vaccination level in our communities, and it hits some of those big traditions.
Yeah, really difficult and very concerning as we're heading into the holiday season as well. So, we want to spend time with our families, and we should, but we should do it in a safe manner. So you want to keep it small, keep it spaced out. If people can get antigen tests prior to coming, if they're outside of your family unit, that's a great idea. Think about ventilation. If you can open the windows and keep it well ventilated, or even take it outside or to the garage if you can, just to increase the air circulation. So
Yep.
keep it small, keep it spread out, keep it safe.
Yeah, we did one of the holidays last year in our garage as well with our family and friends. So thank you for that.
Thank you.
And just to call out to our community again to make sure that loved ones that aren't vaccinated, that are within your power and within your reach, that you encourage them to do that, especially with the surge in the adolescent and child category. We need to get those kids vaccinated as well so that they can, there's a lot of trauma that happens to those kids that experience that as well. So parents can really do that to support their kids. So I appreciate you being here and the great work that you're doing leading us through this very challenging time for us as we continue our journey to be one of the best community hospitals in the country. Thank you.
Thank you.